Hi, I'm Dr. Joel Goldstein. I'm the medical director and founder of Fertility Specialists of Texas. I wanted to talk to you today a little bit about some of the questions that I often get in the office about in vitro fertilization. IVF is a procedure that's been around since 1978 and has resulted in the birth of over 1 million children. It's a technology that basically increases the probability that pregnancy will occur. Normally, women produce 1 egg a month, and that egg is either fertilized or not. And if it's not fertilized, then you have your period. With in vitro, that you are really on medications that allow you to produce multiple eggs, and that's how it really increases the probability of pregnancy, because you have multiple eggs. So typically you're on medications, injectable medications, over a period of 10 to 12 days. During that time, you have monitoring done in our office, which is really blood work and ultrasound. I like to say the blood work checks the ultrasound checks the blood work. Typically, after you've been on medication for about 10 days, you take a shot, which is a shot that causes the final maturation of the eggs. 36 hours after you take that shot, then, as opposed to doing an IUI or doing timed intercourse at home, then you would come into our office and you're given IV, you're given medication through the IV, and you're asleep. And we remove those eggs. We aspirate those eggs with a small little needle that goes through the vaginal wall, and those eggs are then removed and they are given to the embryologist. So at the time of your retrieval, the embryologist will tell you how many eggs you have, how many eggs that we obtained. And then those eggs will then be fertilized with your husband's sperm. Depending on his sperm count, if his sperm count is normal, then we'll just do natural fertilization. We'll take the sperm, we'll put it with the eggs, and allow the eggs to be fertilized naturally. If there's a problem with the sperm, for example, if the motility is low, if the morphology is abnormal, then we will use a procedure called ICSI, which means Intracytoplasmic Sperm Injection. So the embryologist will physically inject a single sperm into the egg, which allows fertilization to occur when otherwise it would not have occurred. So let's say you had 16 eggs. Typically, you expect them 80% to fertilize. So let's say you had 14 of those fertilized, either naturally or with ICSI, and then they are embryos. So they're not eggs and it's not sperm, they're embryos. And those embryos divide over a course of 5 to 6 days. During that time, the embryos divide in the laboratory. Typically, you'll get a phone call the next day after IVF, and you'll know how many of your eggs fertilized. So if you have 16 eggs, 14 fertilized, you may have those 14 fertilized eggs could then go down to become like 8 embryos on day 3, and then on day 5 you could have 3 to 5 embryos. On day 5 or day 6 is the time when the embryologist you may elect to have the embryologist biopsy the embryo. So they take a small amount of the cells that are surrounding the embryo, and those cells are then sent to a laboratory where in about a week or 2 weeks we get a report, and the report tells us if the embryo is chromosomally normal. In other words, if it has 46 chromosomes, and it tells you the sex if you elect to know that information. The main reason we do pre-implantation genetic screening is to determine if the embryos are chromosomally abnormal, because that is that's one of the more common causes for having a miscarriage. So we want to know if the embryo is chromosomally abnormal before we transfer it inside the uterus. After you've gone through the IVF procedure, typically you get a report back maybe a couple weeks from then, and then you start the second part, which is really preparing your uterus with hormones to make it in the perfect state so we can transfer a single embryo inside the uterus. When we do the embryo transfer, this is not done with anesthesia. This is done in our procedure room, whereby that we use an ultrasound, so you and your partner, your husband, can actually watch on the screen. Initially, we'll give you a picture of your embryo, and then you'll do the embryo transfer, which takes about 10 to 15 minutes. We put an ultrasound on, and you can actually watch the catheter go inside the uterine cavity. This is the culmination of the whole time, from the very first time you came to our office to this procedure, which is really, really important and really exciting. And we put the catheter in, typically you're able to see this under the ultrasound guidance. And then 10 days after that is when we do a blood test. That blood test is to tell us if you're pregnant or not. We typically would repeat that blood test in a couple of days or even a week later. And then about 3 weeks after that is when we do an ultrasound. And that is like a amazing and really exciting time, because that's when we're able to do an ultrasound and look inside the uterus, and most of the time we're able to hear a heartbeat at that time, a heartbeat of a baby that you are carrying. And then we make sure the measurement looks okay. We would maybe repeat it after a week, and at that time we would release you to your OBGYN. So in summary, IVF is an advanced procedure that's used to help you achieve a pregnancy. That the success rates with IVF are really related to age, right? So the younger you are, the higher success rate is, and it's really been responsible for a lot of parents being able to have kids. In summary, hopefully you found this really useful, and if you have any specific questions, we are really happy to answer those questions, because we want you to have as much information you can to be able to make a decision on whether IVF makes sense for you, and make sure you understand that process.